Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, so much has been happening since the last time we talked. Mississippi's abortion ban went up before the Supreme Court. The Supreme Court made a decision in the Texas abortion case. So many abortion things. So I guess we'll start maybe at the beginning with the Mississippi case. So we talked about it on the podcast before. Mississippi has a 15-week abortion ban. Basically, they're going to take one of the core holdings that's like a central tenet to Roe, which is pre-viability abortion bans are unconstitutional, and sounds like they might be okay with it. This would be terrible, right? Like, this would just lead to a race to the bottom of like, okay, 15 weeks is cool. Okay, what about 10? What about 6? Oh, right. Well, what about 6? I guess that takes us to Texas. So they released their decisions on Texas. They dismissed the U.S. case in U.S. v. Texas. So that's not great. They also said that Texas abortion providers can challenge some parts of SB 8 for some of the state licensing, but not for everybody that they were trying to be able to sue. So that's not super great either. Like, it's great that they can continue to sue to try and stop it, but they can't sue everybody that they were needing to sue to be able to block this law. And the Supreme Court is letting this law stay in a place until, later, if they strike it down at all. So right now, I'm recording this on Friday, December 10th. Basically, people haven't been able to get abortion for over 100 days in Texas. And like, just to give you a scope of like what that is, and I'm saying women because that's what the data is, 1 in 10 women of reproductive age lives in Texas. So that means 1 in 10 women in the US live without the ability to access abortion, without traveling out of their state. And like, that is unreal. 1 in 10. That is so many people that are not able to exercise their constitutional rights, to exercise their human rights. It's just so terrible. And my heart just breaks for all of those people who are put in these situations. Another thing that really just was like the cherry on top of the cake for this Supreme Court ruling is, they made this ruling that is going to continue to violate the human rights of so many people living in Texas on Human Rights Day. That's right. December 10th is Human Rights Day. And so they issue a ruling basically violating people's human rights on Human Rights Day and allowing this just unimaginable human rights crisis to continue. So many people need access to abortion care in Texas right now that are not able to get it, right? Like, not everybody is going to be able to travel out of state to get the care they need. And it's just heartbreaking. And again, we're really lucky that we had another really fire dissent from Justice Sotomayor. And, it's really great. You should all read it in its entirety. But she has a lot of fire in it. Like, the court should have put an end to this madness months ago before SB 8 went into effect. It failed to do so then, and it fails to do so again today. Y'all, like, this has got to stop. This is, people need to access abortion care. It is time sensitive and people need it. And, in the previous episode, we talked to Dr. Foster about the Turnaway study and what that showed. And, it really shows that things like this really just stop people from getting abortion. And this has long-term implications on their lives. And so, yeah, we need this to stop. The fight will go on. We will keep fighting. It's just infuriating in the meantime and heartbreaking. Unfortunately, sorry, y'all, that's another heavy introduction. I was really hoping to do something light because we do have a heavy episode. So I guess I'll stick the light in here as well. And that is, y'all, this little baby is turning 4. Our birthday, we released the podcast for the first time on December 19th, 2017. I cannot believe this podcast has been going on for 4 years. We've released 126 episodes. What? If you had told me when we started this podcast that it would still be going 126 episodes and 4 years later, I don't know that I would have believed you. And I don't know that it's that I thought it wasn't going to be a success or that people wouldn't listen. Wow, thinking that we would still be doing it 4 years later is wild to me. And I think I've told the story on here before. I was a little reticent to start it. So I'm very grateful to my boss who maybe pushed me out of my comfort zone. My comfort zone would not be being on mic talking to all of you. But I'm really glad he pushed me to do it. And so even though I did get dragged a little bit kicking and screaming into doing this, I am just so grateful that he pushed me. So thank you, Bob. Thank you for getting me to do it and then giving me the freedom and the autonomy to create my own vision of what this podcast could be and letting me talk about whatever issues we wanted on this podcast, as long as they related to sexual reproductive health and rights. I just am so grateful that I had the autonomy to create the show the way I wanted. And I'm really proud of the product that we have worked so hard to put out. I am so grateful for my friends who pushed me as well. When I was first talking to people, when this was just like a little baby of an idea and I was still unsure if this was a good idea, I had some amazing cheerleaders who were really pushing me and really cheering me on that this was a great idea and we should do it. And I'm always going to be grateful to them for pushing me. So thank you, Nina and Lena and Lisa and so many others who gave me that push I really needed in the early days. And thank you to Meg, who always does the most to make me sound the best, for being a great editor and helping me get the podcast started with all the technical things like how do I record and all of the things. She has been there since day one helping me do all of this and to make the podcast sound the best. And I really appreciate her. And I goes double for making me still sound good as for the last, almost 2 years now since I've been recording at home instead of the nice studio we set up at the office. And then just a super, super huge thank you to Rachel. Yeah, she has been the heart and soul behind this podcast for day one. She has helped me so much, whether it is I'm struggling with what is the best way to create an outline for how we're going to walk through the interview for this particular topic. She's been there with me to help brainstorm the path. She is the one who makes our website look wonderful. She is the one who does all of our social media and graphics, and she helps so much. And I just could not imagine doing this podcast without all of her help. And she has been here since this was a little baby of an idea. She was here before launch. She just was here to help through so much. And 4 years of a podcast and 126 episodes, I couldn't have done it without her. And even though you don't get to hear her on microphone other than in our 100th episode where she interviewed me, she is just as important to all of this as I am. So Rachel, thank you, thank you, thank you. And one more last and not at all least, I am so grateful for all of you who tune in and check out our episodes. I am just so grateful for everyone who takes time out of their day to listen to all of this. And thank you. We couldn't be doing this podcast without all of you, and you're so important to all of this. So thank you. And with that, I think we'll turn to this week's interview. So like I said, this week's interview is a little heavy. So just a fair warning. So just a little bit of a trigger warning, y'all. It is about rape. It's about rape as a weapon of war. Nothing graphic, but we do talk about it consistently throughout the entire interview because that is what this interview is about. So If you are not in a place to listen to it, come check back later. If you are able to, if you need to skip it entirely, totally understand. Just know we need to repeal Helms, and we'll see you at our next episode if you're unable to listen. For those of you who are able to, I am so excited to finally be able to do this interview. I'm talking to Jill Filipovic. She is a freelance reporter who wrote this really amazing piece this summer on how U.S. abortion politics distorts women's lives in conflict zones. It's a great piece. I will include links to it. It's really long. It's wonderfully reported. It's a great, hard, heavy read, but you should absolutely check it out. But I'm super excited to talk to Jill today. So with that, let's go to my interview with Jill. Hi, Jill. Thank you so much for being here.
Hi, thanks so much for having me. We're both laughing because my cat just stuck his butt in my face as soon as you welcomed me
let
to
me
the
press
show.
Record. Before we get started, do you want to take a second and introduce yourself and include your pronouns?
Sure. My name is Jill Filipovic, she, her pronouns. And I'm a freelance journalist, a non-practicing lawyer, and the author of 2 books, The H-Spot, The Feminist Pursuit of Happiness, and Okay, Boomer, Let's Talk How My Generation Got Left Behind.
Perfect. I am really excited to have you here today, even though it's to talk about some pretty horrible things. You wrote this great piece over the summer. I'm losing track of time. I think it was late summer. That was in the New York Review of Books. That was just really powerful piece that, one, everybody should read. So we'll include in our show notes. But 2, really kind of talked about rape as a weapon of war and how this is interacting with U.S. abortion politics. So maybe we should start at the beginning and just talk a little bit about women's lives in conflict. You maybe want to start there?
Sure. So I ended up writing this piece because I had been doing a lot of reporting, from all over the world, in the US for a long time, and then also in Latin America, Asia, Sub-Saharan Africa, looking at women's rights and health from a variety of angles. And one thing that started to become very apparent, spending a lot of time in these places, was that a lot of the reporting on conflict and women in conflict has gotten a lot better over the last few decades, right? Especially as women have made up more and more of the ranks of foreign correspondents and journalists generally. That stories about conflict are not just about, the bang bang, but they're also about what happens after, how conflict affects other vulnerable populations, and not just the focus is not entirely on the fighting itself. And so there's been much better coverage, including in the war in the Balkans, including in the genocide in Rwanda, of sexual violence against women. We saw pretty extensive coverage of sexual violence in the crisis where ISIS fighters were raping and enslaving Yazidi women. We saw great coverage of sexual violence in South Sudan. So I really think that journalism has undergone a pretty incredible shift in this regard, and that is mostly to the credit of female journalists. So I was seeing a lot of great reporting on that, and I was increasingly seeing really great reporting on the outcome of rape in war, which is that a lot of women wind up getting pregnant when they really don't want to be, and often in really vulnerable circumstances, in post-conflict settings, in refugee camps, in settings where their male partners or family members or children may have been killed, where they themselves are obviously survivors of pretty enormous trauma. But I noticed that much of the reporting kind of stopped there. It would talk about children born of rape. And it struck me that there was this huge gap because, in our current modern world, have the tools to end unwanted pregnancies and to do so safely. And so I wanted to explore that gap, why these stories weren't being covered, and essentially whether women were actually able to access safe abortions in conflict and crisis and post-conflict and crisis settings. So that was the genesis for the project, to kind of dig into this space that I hadn't seen covered particularly well. And it felt important in part because I think the way that we talk about abortion rights in the US especially is very much about abortion as this divisive political issue. In this story, I was really hoping to situate this question of abortion not as one necessarily of politics, although it's certainly one of power, but of a question of essentially human existence and healthcare, and sadly, a really normal thing that women go through, which is sexual violence, and in conflict, endemic and often, planned out and weaponized sexual violence.
I think you did a really great job of that. And it links to something you talked about earlier, which is a lot of the reporting would talk about, women who would get pregnant and then the children that would result. But one statistic you brought in is that women in conflict, that's where you see the highest maternal mortality rate. So like when we're talking about these things, it's really not hyperbolic to say this is like life and death ability to access essential healthcare.
Yeah, it absolutely is. And one thing that I think is heartening is we have seen not all and not even most, but a small handful of humanitarian organizations, kind of most prominent among them, Doctors Without Borders, taking on that same perspective, right? Which is that every abortion is a life-saving abortion. We know that in conflict and crisis and post-conflict settings, people have essentially seen their whole lives and everything that they thought was sort of normal, and their whole future is obliterated, right? I mean, that's what conflict and crisis does. So when women are in those positions and are pregnant from a serious trauma like a rape in war, what we see is that women do what women do everywhere in the world when they're pregnant and don't want to be, right? Which is that they seek ways to end that pregnancy. And if there are safe or somewhat safe ways for them to do it, they do it that way. And if safe ways aren't on offer, then they figure out what's available and what's possible. And a lot of those women die. And one thing that was really striking in reporting this piece is how bad the data gathering on a lot of this is, right? Data gathering in post-conflict settings has a whole series of obvious challenges, but we actually don't know how many women die of unsafe abortions in refugee camps, for example. We do know that maternal mortality in those settings is quite high. So we know that carrying a pregnancy to term is a very dangerous thing, whether that's by choice or by force. And in most refugee settings, safe abortion is just not available, even in countries where abortion is legal, right? So overwhelmingly, it is by force or coercion that a lot of women are carrying pregnancies to term and giving birth. So, we know that unsafe abortion is really common in these settings. We know that some number of women, that's my cat yelling for pets. We know that some number of women, and probably a large number of women, are becoming seriously injured or dying from unsafe abortions. And we know that rape in conflict is endemic, and that many women who are raped in conflict and then impregnated do not want to have babies resulting from that. And yet there has been this huge gap ever since, the whole concept of a refugee setting was even established. There's been a huge gap in providing safe abortion services, because even in humanitarian settings and even among these groups that are, incredibly brave and forward thinking in a whole series of ways, abortion remains politicized and stigmatized.
Yeah. And I think it's it's always important to have this conversation because there's always, unfortunately, a crisis or conflict happening. But right now, you're hearing the reports out of Ethiopia. You still hear things from your article highlights the DRC. And, it just seems extra timely to be having a conversation about what is happening and what needs to change.
Yeah, I mean, the unfortunate reality is there, at least, as far as I know, in the past 100 years, more than that, there has never been a time, right, where this issue is irrelevant. So you've mentioned a few sort of ongoing conflicts where sexual violence is being used as a tool. We know that that sexual violence has been a component of conflict for a very, very long time. And we know that when women are raped, some women get pregnant. And we know that when some women are pregnant from rape, they do not want to carry those pregnancies to term and will do anything or almost anything to prevent that from happening. And so it really is crucial that, when we are talking about this issue, that we do take it out of this very American frame of pro-life versus pro-choice, right? I mean, obviously I'm pro-choice, but I think that the idea that abortion is primarily a divisive political issue can be a really unhelpful way to approach these questions of humanitarian aid and development aid and what women actually need and what is actually happening on the ground. And unfortunately, the US is the largest funder of development aid in the world. And obviously, we're a huge funder of humanitarian aid. And so American politics do set the agenda for what women who have no right to vote in our elections, what they have access to. And I think we see this in the kind of starkest possible terms in this context of abortion access in refugee settings and in post-crisis settings. Because essentially what happens is the American abortion debate has made it so no US dollars go to fund safe abortions, not for rape survivors, not for refugees, even where it's legal in the country in which these women are. And even when under US law, US dollars should be able to pay for these procedures, but they don't. And that is largely because of the way abortion is treated as a contentious political and partisan issue in the US.
Yes. So that brings us to the two policies that you really highlight in your story. So I guess let's start with the Helms Amendment, which is the one you've just been referring to.
Yeah, so the Helms Amendment, which is named after famous segregationist Senator Jesse Helms, essentially says that no US dollars, no USAID and foreign aid dollars can be spent on abortion as a method of family planning. And so abortion rights groups have interpreted that as saying, okay, well, you can't essentially fund elective abortions, but abortion in the case of a threat to a pregnant woman's health or her life, abortion in the aftermath of rape, that is not, under that phrasing, an abortion primarily solely for a method of family planning, and therefore US dollars should cover those abortions. That doesn't happen. USA dollars just never pay for abortions. And abortion rights groups have been asking various presidents, they asked Barack Obama, they're currently pressuring Joe Biden on this, to simply issue a clarification, right? To just say, according to the flat out language of this amendment, USA dollars can pay for abortions for rape survivors. They can pay for abortions that threaten a woman's life or her health. And even Democratic presidents, President Obama, President Biden, have refused to do that. Biden obviously is in office right now. He could still change his mind on that. But overwhelmingly, even elected Democratic presidents have not been willing to do that very, very tiny thing that could make a huge difference for a lot of women. We have seen a whole group of women in Congress trying to pass a law that would essentially overturn the Helms Amendment. As far as I understand, that is really, really unlikely to happen. There's a separate effort to permanently repeal the global gag rule, and that one seems to have more legs, so that's some good news. But the efforts to stop Helms in its tracks don't seem to be gaining any steam, and from everything that I've seen and heard, seem unlikely to come to fruition. So Joe Biden could do a lot here. He has, so that the Hyde Amendment is essentially the domestic version of Helms. It's kind of the easiest way to say it. The Hyde Amendment says that Medicaid, which is the US program that funds healthcare for low-income Americans, that federal Medicaid dollars cannot pay for abortions under the Hyde Amendment. And the Biden administration has made some efforts to strip the Hyde Amendment out of its budgets. So that's good. They could do that with Helms. They haven't wanted to expend that political capital, which I did an interview with Sarah Sippel a couple months ago, and she phrased that as this kind of democratic America first view, which I found to be very compelling. So yeah, the Biden administration has just so far really refused to do anything about Helms, has refused to do anything to stand up for the basic rights and frankly, the lives of women who have survived sexual assault overseas.
Yeah, I would say there's definitely been this big push. One, the push to repeal Hyde is much further along than the push to repeal Helms. And yeah, the groups are really pushing to be like, we need to get rid of Helms. But in the meantime, this is the bare minimum of what you can do to make sure that women in these situations are able to exercise their right to abortion. And these exceptions appear everywhere else within U.S. policy, right? So the Hyde Amendment has life, rape, and incest exceptions. they're not super easy to use, but they're there. And so it's really just trying to get it on that same level playing field at the minimum while we're waiting for repeal.
Right, exactly. And yeah, I mean, I think the law does need to be repealed. Obviously, it's hugely detrimental, but it is pretty shocking is perhaps not the right word, but disappointing and I think offensive that Biden won't even issue a basic clarification. That is like such a tiny, small thing. And on something that the vast majority of Americans are aligned on, including a lot of Americans who self-identify as pro-life. Obviously the sort of extremists who have control over pro-life organizations and the Republican Party do not want to allow safe abortions for rape survivors. But many kind of average Americans who self-identify as pro-life do understand or do believe that this is a little more complicated. And this is something that most people would want to allow an exception for. And so it's very frustrating that, Biden is again seeing this as a sort of political capital he has to spend rather than not wanting to spend it here, rather than just using the power he has to do the right thing.
Yeah. And I think one thing that your article also did a really great job of illustrating was talking to the doctors or people in the camps who were talking about, we can provide post-abortion care once that woman goes and gets an unsafe abortion, but we had to turn her away from getting the safe one because we couldn't provide it. And like, that just seems just devastating.
Yeah. I mean, this is one of those just like total absurdities about the way that the US handles the question of unsafe abortion is that the US has, for many years now, dedicated quite a bit of funding and training to what's called post-abortion care. And post-abortion care, you guess that listeners to this podcast probably know what this is, but in case you don't, post-abortion care is essentially a set of procedures that help to complete an unsafe abortion and save women's lives. And so it can look like a lot of different things, but kind of the most common two are either using MVA equipment to complete an abortion or using what is essentially medication abortion pills to complete an abortion. This is also the same treatment for an incomplete miscarriage, which is a pretty common thing that can also threaten women's lives. So post-abortion care, what you offer a woman who has tried to self-induce her own abortion or has gone to a local freelancer and it hasn't worked, the care that a medical provider will offer to her is pretty much the same thing as an elective abortion, right? It's the same machine or it's the same set of drugs. So anyone who's trained in post-abortion care, which at this point, unsafe abortion is so common in humanitarian and development settings that a lot of people are trained in post-abortion care. Anyone who's trained in post-abortion care can also give a woman a safe abortion, right? And because unsafe abortion is so common in humanitarian and refugee settings, you have a lot of healthcare providers in those settings who have this skill set, right? And so it'd be very easy to just say to those folks, if a woman comes in seeking an abortion in the first place, you can offer it to her. Instead, what US law requires is that those healthcare workers who know how to perform safe abortions, who have all the tools, who have the drugs, who have the training, have to tell her, no, we can't do this for you here. And then if she predictably goes somewhere else to seek out an unsafe abortion and comes back, they can then do the exact same procedure they would have done in the first place to help her complete the unsafe abortion and not get seriously injured or die. And so the cost of that, obviously, is women who are badly traumatized, some number of women who die, a larger number of women who are badly injured, women who permanently lose their fertility, women who are then going to go on to have more issues in childbirth because unsafe abortions can be very damaging. It's sort of the worst of all worlds, right? There isn't much evidence that it actually prevents abortions. There is a lot of evidence that it fuels a much higher number of unsafe abortions, which are then, obviously harder to treat when women come back in. So it is this really, really perverse set of rules. One thing that was, I think this did not actually make it into the piece because it was just getting a bit too far afield. But, one thing that I find very scary is that post-abortion care under George W. Bush was a pretty well-funded endeavor, and it was something that even abortion opponents agreed was important. Under the Trump administration, there was actually kind of a curtailing and scaling back of post-abortion care. And many folks in the anti-abortion movement who had the ear of that administration have begun to see even post-abortion care as suspect, which, I think kind of calls into question how accurate that the pro-life moniker is for them, when the idea of saving women's lives is unpopular just because the method by which you have to do it is the same way as an elective abortion. So, it is this absurdity in how the US treats pregnant women and women seeking abortions, which is that we will help you out if you've tried to do this yourself and if your life and your health are at risk, but we will not just in the first place help you to do this safely.
Well, I think that brings us perfectly to the second policy, since you brought up Trump, the global gag rule, which was around before him, but got much worse under Trump.
Yeah, so the global gag rule has been around since the Reagan 80s. And back then it was called the Mexico City policy. And it's sort of changed under various Republican presidents, but essentially in kind of its initial iteration, it applied to U.S. funding for family planning services overseas. And it said that funding could not go to, it already couldn't go to pay for abortions. That's been true since the 70s. But it couldn't go to any advocacy for abortion rights. It couldn't go to groups that advocated for abortion rights. It couldn't go to groups that referred women to safe abortions. And it couldn't go to groups that perform safe abortions with their own non-US money. So that was bad. And that rule was in place under every Republican president from Ronald Reagan going forward until the present time. And it has been rescinded by every Democratic president. Although, again, to clarify, even under Democratic presidents, not a single dollar of U.S. foreign aid money could be spent on abortion procedures. So, the part of the problem with the global gag rule generally is that it does have this very broad, chilling effect. It puts abortion in this category of healthcare that is stigmatized, that is considered kind of separate from all other reproductive health services. And it makes it in practice so that many of these organizations that receive US funding just don't touch the abortion issue, because you're really not going to be able to change an entire organization's policies every 4 years, depending on who's in office. And when you're talking about the folks that are actually meeting with women and with patients one-on-one, you're talking about folks who are mid-level midwives in rural Ghana, right? And whole teams of these folks who do incredible work, but whom it is just not realistic to retrain every single time US policy changes, right? And so one outcome of the global gag rule is that even when it's not in place, many organizations still operate as though it is, just because it's untenable to kind of do otherwise, right? So, and some don't, to their credit, but many of them do, because there just really isn't much of another choice. So the Trump administration made the gag rule much worse, in part because they expanded it beyond just family planning funding and into all US aid dollars abroad. So any organization working on anything at all then had to treat abortion as this kind of highly stigmatized, blacklisted, don't talk about it or you lose US money issue, which, is a huge problem when the US is such a major funder of development and humanitarian aid overseas. So, the gag rule, again, it's great. Democratic presidents rescind it. That is kind of the least that we should expect from them. But it really does need to be permanently repealed, because the reality is that, yes, when the gag rule is not in place, more dollars flow into organizations that fund contraception, right? And that's great. The gag rule really does mean that groups that are doing really important public health work don't get US funding when they need it. But the gag rule, even when it is not in place, still kind of functionally casts a shadow, especially over a lot of smaller organizations and especially over how things operate on the ground. So repeal of the gag rule is really, really crucial. And again, even if it is appealed, not a single dollar of US money will go to fund abortions, but it will mean that organizations that provide healthcare in countries where abortion is legal can tell women that that's an option.
Yes. And like you said earlier, we're actually very close to making sure that it's often referred to as a light switch, although as you just showed, it still lingers even when it's not in effect. Maybe we can end it for good. The hope is to get it done this year through appropriations, and it's so close to happening. I can taste it. So everybody keep letting people know it needs to happen. Okay, so now we have the idea of these two policies that need to go. What do we need to do to kind of fix this? And what is a good example? Because I think you talk about the Rohingya crisis and how that didn't kind of repeat some of those same problems.
Yeah, so one sort of inadvertent outcome of the Trump administration is that, that administration's attacks on reproductive rights, on women's rights, on LGBT rights, on democratic norms, on all of it was a real shock to the system, I think, for a lot of countries around the world, and particularly for kind of more progressive and feminist minded ones. And a lot of those countries decided essentially to go it on their own without the US, right? To say, okay, the US does have a huge amount of money and power and influence, but perhaps the rest of us can kind of band together and try to fill the gap that they're leaving. So you saw this in, for example, the She Decides effort, which was a bunch of Nordic countries and then kind of other European countries who decided to expressly attempt to fund safe abortion where the US wouldn't. And you've seen it among humanitarian aid organizations that don't take US dollars. And so in Bangladesh, which is where, close to 1 million Rohingya refugees came in from Myanmar fleeing a genocide, a hallmark of which was mass rape. You saw for the first time in a refugee setting a concerted effort to provide safe abortion services. And in the process of hundreds of thousands of refugees fleeing, a lot of the reporting was on these systematic rapes. And there was a lot of preparation for what people expected to be kind of a whole mass of essentially abandoned infants 9 months after the first wave of refugees came to Bangladesh. And that actually didn't come to pass. A lot of women were able to get safe abortions through organizations like MSF, through clinics, formal clinics set up in the camp. And a lot of women were able to procure abortion-inducing drugs from kind of more informal pharmacies that were set up in the camps. And so, those procedures are not as safe as procedures done in a formal clinical setting with a trained medical professional, but they're a lot safer than the kind of old way of doing things, right? Which was like putting a stick through your cervix, the kind of in the US, the sort of coat hanger model. Misoprostol is widely available. It's a drug that induces miscarriage or abortion. It is a drug that is very cheap, and it was widely available in the refugee camps in Bangladesh, and a lot of women made use of it. And so that really is the first time where safe abortion, and kind of moderately safe abortion, has been widely available for rape survivors in a refugee setting. And what we saw is there was a huge demand for it, and that women used it, and that I think, again, there's still serious data gathering issues here, but that what you didn't see was, a whole bunch of women seriously injured or dying from unsafe abortion. And what you didn't see was kind of the expected wave of abandoned infants from women who felt unable to raise a child of somebody who had attacked them in a community that's really, really conservative, and where in doing that, you would sort of make yourself a pariah for the rest of your life.
I really love that this was it was towards the end of the piece, if it was not the very end, because it just, this like hope of like what having access to safe abortion in these camps for all these displaced people would mean after just so much just tragedy before it, right? Like, it was just so upsetting. And to end on this vision of a better world that was still fleeing mass rapes and stuff, but at least, they were able to access safe abortion care. And it was a hopeful end.
Yeah, I mean, I found the provision of safe abortion care in Bangladesh in that setting to be heartening. I think what's important to emphasize is that, it's not that women in these settings being able to access safe abortion, like, then makes their lives 1 million times better, right? These are women for whom life has already gotten really, really bad, and who need much better services, kind of all in like 360, right? Need the legal right to be somewhere, need the right to work, need the right to safe housing, need the right to physical safety. There's a very, very long list of folks who are waiting to be resettled in safe countries. And most countries in the world, I would say every country in the world, doesn't quite take on their fair share of refugees who need safe haven. And many countries that house a large number of refugees, also put tremendous burdens on refugee communities and, don't give folks what they need to start building their lives back. So, it's not like abortion is this magic wand that you then wave and, then women wind up fine. It is one tool that prevents women who have already seen their whole lives devastated. It's one tool that allows those lives to not get even worse against their will, right? These are women for whom control over their lives, over their physical bodies has already been taken away in the sort of most shocking and traumatic and violent way possible. And then to be told that they also don't have control over the aftermath. It's I think, kind of unforgivable compounding of that cruelty and that trauma. And frankly, I would argue that the impulse to rape women, to sexually violate women, stems from the same impulse as the impulse to control what women do with their bodies generally, and to force women into birth against their will, to force women to continue pregnancies against their will. They are not the same things, but I think they exist on the same continuum of violence against women. And certainly forcing women to continue pregnancies that were forced upon them by rape is just one of the most astoundingly cruel things that I can think of. And so offering women safe abortion services does not undo the initial trauma. It does not fix all that is wrong in the way that we treat refugees, in the way that we treat sexual violence survivors, in the way that we treat everyone impacted by conflict and crisis. But it does allow women to maintain a tiny bit of control over their own lives and over their own bodies in a context in which that control has been stripped out in every other aspect of their lives.
Okay, so now that our audience knows more about these situations and the policies that are not helping in these situations, what actions can our audience take to make sure that this stops, or at least these policies stop?
Yeah, I think putting pressure on the Biden administration, any administration, to improve policies both on safe abortion access, right? So overturning Helms, repealing the global gag rule, those are two big ones, but also on just better refugee policy generally. So, more robust funding for humanitarian work, radically raising the refugee resettlement cap in the US, pushing other countries to also open their doors to refugees. I think those are really big ones. And also just being mindful of, which organizations you're giving your money to and supporting, whether those are in the humanitarian or development space, and asking, are these organizations that support a full range of reproductive health, including safe abortion care? And if they're not, part of this problem is that abortion is treated as a stigmatized issue, including by a lot of players in the humanitarian space. And so, if organizations aren't supporting safe abortion or are silent on safe abortion, asking whether that is the best way to spend your dollars, or whether that money should go to groups that have a more holistic vision of what folks need on the ground.
And I would just add that, the women, peace, and security agenda is something that is really important to the Biden administration. So making clear that this is part of that, right? That one, permanent global gag rule repeal and Helms, getting rid of Helms. But in the meantime, making sure that those in crisis settings are able to access safe abortion is so important and is part of that women, peace, and security agenda. Definitely. Well, Jill, thank you so much for being here. I really enjoyed talking to you.
Thank you so much for having me.
Okay, y'all, I hope you enjoyed my conversation with Jill. Like I said, it was a really heavy topic, but it was so important that we talk about all of this so, you get a really clear vision of why Helms needs to go. And until then, until we can get Helms completely gone, it's really important that the US government does not continue to enforce Helms as a complete ban, right? We need to make sure that people who are victims of rape are able to access safe abortion care. And the US needs to quit being a barrier to that. So Helms needs to go. I guess with that, this is our last episode before the holidays. So happy holidays. I hope everybody has a wonderful holiday season. I'll see you with one more with our end of the year episode. It's going to come out before the new year. thank you all for listening. I'm really grateful for all of you. And yeah, with that, I guess the usual, right? Like if you have anything you'd like us to talk about or have questions for me, always feel free to email me at jenny@reprosfightback.com. And that's Jenny with an IE. Or you can shoot us a message on social media. You can always find us there at rePROs Fight Back on Facebook and Twitter and rePROs FB on Instagram. And with that, I'll see y'all in 2 weeks. For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at rePROs Fight Back and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.